Welcome to the deep dive. Today we're tackling a really important health issue. It affects our pets specifically, nursing dogs and cats. We're talking about mastitis. We've got some quite detailed medical info here. And, well, our mission is to really distill it down for you. Get to the core of what it is, why it happens, how you spot it, and, how it's treated.
Exactly. We want to cut through the jargon, pull out the key stuff, hopefully give you those useful insights, maybe even cover a few things that might surprise you about it.
Okay, sounds good. Let's dive in. So
Yeah.
just the basics first. What exactly is mastitis?
Right. So fundamentally, it's a bacterial infection. It takes hold in one or more of the mammary glands, the milk-producing glands in a lactating female.
Okay, bacterial infection. How do the bacteria usually get in?
The most common route seems to be bacteria traveling up through the teat canals. Pretty straightforward entry point. But the sources also mention sometimes it can be from physical trauma to the gland, or even bacteria spreading through the bloodstream from elsewhere in the body.
Interesting. And are there specific bacteria we should know about? The main culprits?
Yeah, there are a few common ones. You've got E. coli, Staphylococcus,
Staph, yeah.
right, and beta hemolytic streptococci. Those are sort of the big three. Though, interestingly, the reference also flags less common things like mycobacterium or even a fungal cause, blastomycosis.
Fungal too.
Yeah, rarer but possible. But the really crucial thing to grasp is how serious it can be. It starts local in the gland, but it has the potential to become systemic, leading to septic shock. It can actually be life-threatening.
Wow, okay. That definitely underscores the seriousness.
Yeah.
So who's most at risk? Is it mainly new moms?
That's pretty much it. The signalment, as we call it, points heavily towards postpartum bitches and queens, so dogs and cats after they've given birth.
Makes sense.
But here's a slightly surprising bit. The source notes it can occasionally happen in females having a false pregnancy, a pseudo-pregnancy, especially if they start lactating them.
Really? Pseudopregnancy too? That's not something you hear about often in this context.
No, it's rare, but documented.
Okay, so thinking about someone at home, maybe they're worried.
Mhm.
What are the signs? What should they be looking for, behaviorally or physically?
Well, often the first clues are changes in the mother's behavior. She might lose her appetite, become lethargic, just, sluggish, not herself. And maybe most worryingly, she might start neglecting the puppies or kittens.
Oh, that's a big one.
Huge indicator. Also, check the babies. Are they failing to thrive? Not gaining weight like they should. That's another sign something's wrong with the milk supply or the mom.
Okay, and physical signs on the mother herself.
Physically, you'd look at the mammary glands as one or more firm, swollen, hot to the touch, painful.
Right.
You might also see discharge from the nipple. It could look like pus, we call that purulent, or it might be bloody, hemorrhagic.
Yeah.
In severe cases, you'll see signs of systemic illness, fever, dehydration, maybe even those signs of septic shock we mentioned. And the source warns about complications like abscesses, pockets of pus, or even gangrene, which is tissue death, in the gland itself.
Definitely clear red flags there. So vet visit, absolutely. Now let's dig into the causes a bit more. We know bacteria get in, but what makes an animal more susceptible?
Good question. So bacteria ascending the teat canal is number one, but physical trauma is a big facilitator. Think about little puppy or kitten toenails and teeth scratching, biting.
Yeah, that makes sense. Breaks the skin.
Exactly. Creates an entry point. Then there's poor hygiene. A dirty environment just increases the bacterial load.
Okay.
Underlying health issues can play a role too. If the animal has another infection, like, say, mastitis, a uterine infection that could potentially make them more vulnerable.
So systemic health matters.
It does. And one more specific thing for cats. Sometimes, though rarely, it can be secondary to a benign condition called fibroadenomatous hyperplasia, where the mammary tissue overgrows.
Right, so it's often a combination of factors, it sounds like.
Often, yes, a perfect storm, as you said earlier.
So if a vet suspects mastitis, how do they confirm it? How do they rule out other things that might look similar?
Right, the differential diagnosis. They need to distinguish it from a couple of key things. One is galactostasis, basically. Milk just backing up in the gland, milk stasis. The key difference there is usually the animal isn't systemically ill.
Okay. No fever, no lethargy, maybe.
Generally, yeah. And looking at the milk cytology under a microscope and culturing it helps tell them apart. The other big one to rule out is inflammatory mammary adenocarcinoma. That's a type of cancer.
Cancer, okay.
With that, the gland usually isn't producing milk, and you'd need a biopsy, a tissue sample, to be sure.
Got it. What about other tests? Blood work? imaging?
Absolutely. Standard blood tests are important. A CBC complete blood count often shows high white blood cells, maybe immature ones indicating infection, though in severe sepsis it can sometimes go low.
Oh, interesting.
Yeah. Biochemistry panels check organ function, hydration status. You might see signs of dehydration, like a slightly high PCV or protein. Your analysis gives more info on overall health, too, and ultrasound is really useful here.
How does ultrasound help? What does it show?
It lets you see inside the gland. You look for changes in the tissue structure. Normal glands have a sort of layered look on ultrasound. With mastitis, you might lose that layering, see changes in echogenicity, how bright or dark it looks, more heterogeneity, meaning it looks less uniform.
Okay.
And Doppler ultrasound can assess blood flow. If the blood flow is poor, that might suggest a higher risk of gangrene developing.
Very detailed picture then. And analyzing the milk itself, you mentioned cytology and culture.
Yes, very important. The culture identifies the specific bacteria causing the trouble. And crucially, it tells you which antibiotics are likely to work. That's the sensitivity testing.
Right, so you're not just guessing with antibiotics.
Exactly. Targeted treatment.
Yeah.
The source also recommends screening for MRSA methicillin-resistant Staph aureus because that needs specific handling.
Good point.
Then there's the milk pH. Normal milk is a bit acidic. Infected milk often becomes alkaline.
Why is that useful?
It can actually help guide antibiotic choice sometimes, as we'll discuss. And finally, cytology, again looking at the cells. Normal milk has some white cells, but infected milk, you see loads of bacteria, sometimes inside the cells, and lots of degenerating neutrophils, those infection-fighting cells.
Okay, so a very thorough diagnostic process leads us to treatment. How is mastitis managed?
Well, often the first step is hospitalization, especially if the animal is quite ill, until they're stable.
Makes sense. What about the puppies or kittens? Can they keep nursing?
That's a really big consideration. The source suggests they can often continue nursing unless the gland is necrotic, meaning the tissue is dying or the mother is systemically very unwell.
Okay, but that affects treatment choices, right?
Absolutely, especially antibiotic choices, because some drugs aren't safe for nursing pups or kittens. And if they are nursing, you have to monitor their weight gain like a hawk. Pups should gain about 10% of their birth weight daily, kittens around 7 to 10 grams a day. Any less is a worry.
Right. Crucial monitoring. What about supportive care for the mother?
Vital. Fourvier fluids if she's dehydrated or septic. Correcting any electrolyte imbalances or low blood sugar. Treating for shock if it's present. And local therapies help too. Warm compresses on the affected glands. Gently milking them out several times a day helps drain infected material.
Milking out the infected gland?
Yes, gently. Helps drainage if the tissue is fragile. Maybe cover it to prevent injury if the babies are still nursing from other glands. And here's that interesting one again. The source mentions cabbage leaf wraps might actually help resolve inflammation faster.
The cabbage leaves. I still can't quite picture that.
I know, it sounds like folk medicine, but apparently there's some anecdotal support, maybe anti-inflammatory compounds. Worth noting, anyway.
Definitely. What if things are more severe, like abscesses or gangrene?
Then surgery might be needed to debride, remove the dead tissue. Sometimes they use things like negative pressure wound therapy afterwards, or just manage it as an open wound while it heals.
Okay, let's talk medications. Antibiotics must be central.
Absolutely. They're the cornerstone. The choice, as we hinted, can depend on the milk pH identified earlier and definitely on the culture and sensitivity results.
Right. So how does the pH influence the choice?
Generally, if the milk is more alkaline, antibiotics that are weak acids tend to work better. Things like amoxicillin, cephalosporins, or amoxicillin with clavulanic acid.
Okay.
If the milk is more acidic, weak bases are often preferred, like erythromycin, lincomycin, trimethoprim sulfa.
Got it. Acidic versus alkaline.
Right. And then some broad-spectrum ones like chloramphenicol or enrofloxacin can work well in either case. But again, sensitivity testing is king.
How long is the treatment usually?
Typically looking at around 21 days of antibiotics. Sometimes they might also do a local infusion of a 1% betadine solution right into the gland.
Into the gland itself?
Yeah, and if the mother is severely ill or just can't nurse, there's medication cabergoline to suppress lactation, dry up the milk.
But then the babies.
And the babies have to be hand-reared, which is a huge commitment.
Definitely. And you mentioned antibiotic safety with nursing.
Yes, super important. Certain ones, tetracycline, enrofloxacin, chloramphenicol, are generally avoided if the mother is nursing due to potential risks to the newborn.
So what is usually considered safer?
Safer choices often include cephalosporins or amoxicillin-based drugs like Clavamox. It's always a careful balance considering both mom and babies.
A very delicate balancing act indeed.
Mhm.
So after treatment starts, what's the follow-up like? How do you know things are improving?
You monitor closely,
Mm.
regular physical exams, repeat blood tests to see if those infection markers are coming down, and follow-up ultrasounds can be really helpful too. You look for that normal layered appearance of the gland tissue to return as it heals.
Makes sense. Can anything be done to prevent mastitis in the first place? Any tips for owners?
Yes, definitely some preventative measures. Hygiene is number one. Keep the whelping or cleaning box really clean.
Okay. Cleanliness.
Shaving the hair around the mammary glands can help keep the area cleaner too. And clipping the baby's toenails regularly reduces scratches.
Ah, the toenails again. Good point.
Yeah, and make sure the newborns are nursing from all the glands, not just favoring a few. This helps keep milk flowing evenly and prevents stasis in some glands.
Promotes even drainage.
Yeah.
Got it. Those sound like practical steps. Lastly, what about complications in the overall outlook?
Well, the main complications, if it's not treated well, are those abscesses or gangrene, potentially leading to loss of the gland. And as we touched on, the potential need for hand-rearing the young is a major commitment and can sometimes have behavioral impacts down the line for them too.
Right, but the prognosis generally.
With timely and appropriate treatment, generally quite good. Most animals recover well.
Okay, that's reassuring. So kind of summarizing the key takeaways here. Mastitis is a serious bacterial infection, multiple potential causes, but recognizable signs.
Exactly.
And getting that diagnosis right. Starting treatment promptly, including the right supportive care and antibiotics, is crucial for a good outcome.
Couldn't have said it better.
And for prevention, hygiene and careful observation of both mom and the baby seem really important.
Absolutely. It really highlights that connection between the mother, her young, and their environment.
It really does. Which kind of leads to a final thought. Considering how this infection can affect the whole body and how demanding nursing is, could a deeper look at the mother's overall health, her immune status, her environment, could that play an even bigger role in prevention and successful management than we currently emphasize?
That's a great point. It makes you think about the interconnectedness of it all, doesn't it? And perhaps where future research might focus supporting that maternal resilience during such a vulnerable time. Definitely something to ponder.